If I have to tell one thing, maybe let's start from the beginning, awareness. Doctors should be aware of the existence of neurological disorder, rare neurological disorder, and should be trained for that.
Patient careway paths, so that when you don't know things yourself, when you do not have the experience yourself, then you have a way to guide people where you have the experience, where you have the information.
I would wish for a faster referral of patients to expert centers.
Improving availability of specialists for distant consultations.
Improve the information sharing.
Enhance the communication between patients and clinicians.
That the patient voice is front and center, because that is super, super important.
I will try to make the system in the European Union more equal.
Because unfortunately the economic situation and the healthcare systems in general are pretty different across Europe.
Bring all stakeholders together, patients, authorities, clinicians and basic scientists to collaborate.
Better cross-border cooperations between European countries, clinicians or maybe the entire world.
Because in one center, in one country, you don't have enough patients to make robust conclusions or to do clinical trials. So collaborations within a country, but also with other countries, is very important to move the field forward.
Educate our communities more with regards to the availability of care for patients with rare diseases. Because whilst at the individual level rare diseases are quite rare, at a collective level they're quite common.
If we educate the general public around it, then it will reduce the stigma that patients with neurological conditions often face.
A multidisciplinary approach, because the rare diseases are very complex.
Treat the whole group around the patient, not just the patient themselves.
Psychological support, because these are very hard diseases.
These are families that need to deal with this for a lot of time, with a lot of things that are really challenging in their daily lives.
Accelerating the development of medication.
There are many gaps in treatment, and the only way to go around that is actually to have funding which will help have the infrastructure to actually assist these patients in a more personalized way.
But we don't have good reimbursement systems for personalized treatment approaches that need to be developed for individual patients. So I think we need this integration of medical need and reimbursement.
The early precise diagnosis.
It's diagnosis, and more concretely molecular diagnosis.
Availability of genetic testing.
Because most of these rare neurological diseases are genetic.
There are some treatable disorder that if you don't miss them, you can really change the life of the patient.
And that's why I feel the European Reference Network is is a great thing for people, even if they live in a remote area in some distant country, because they can be referred if they've no diagnosis, and at least they're in a better way to help themselves and help their families.